Okay, Enti ene minya a question or a request from one of you, someone who has had miscarriages, recurrent miscarriages, asking me to also talk about miscarriages. That it seems that most of the things I talk about, ayana, menshada nka miscarriages wasem papa. Now, me pesa woti ase say ye kase obi enya miscarriage a naturally say unyin no asay before week 20. Okay. Now, when you lose your pregnancy before week number 20, that is when we say you have had a miscarriage. Now, if you lose your pregnancy beyond week number 20, there is another name for it. That's not what I'm talking about. But then I'm talking about miscarriages. That is to say, pregnancies that you lose before week 20. Okay. Now, in Pempino, you are wondering what may account for such losses. Most of the time, that is what you are wondering. Nyisenya bijidi say bibia ye okay no, all of a sudden nyisenya aye den asay. Okay, now one of the key reasons why you may have a miscarriage, that is, you may lose your pregnancy before week number 20, implantation troubles. We've talked extensively about implantation difficulties and how they eventually will lead to a miscarriage. Okay, now you need to say after you have gotten your eggs fertilized by a sperm cell, the fertilized egg will have to move from utubunum into your uterus. It implants in your uterus, and that is where your baby grows. When there is any challenge with this particular event or this particular process of implanting or fertilized egg, into wawudienuma, you are likely to lose that pregnancy. Now, there are infections, so yeah, there a bit to me ama you will lose or pregnancy before week 20, and now a bit to me ama when ya miscarriage, hormonal imbalance, and so yeah, then ekahobi in say oba, you are actually largely hormonal. All right, you are regulated heavily by hormonal interactions. And when there is an imbalance of the hormones responsible for regulating your reproductive cycle, all of these things, miscarriages Now, you also talk about the age factor, and also can be in fear also increases your risk of having a miscarriage. Okay. Now, you bet me a cancer about an incompetent service. We know say your service must stay closed. All right, that is what your service must be after you have taken seed. It has to stay closed. And to say service no problem or at the time when the service has got to stay closed to not a beer. That will also increase your risk of losing that pregnancy. Okay, so an incompetent service or cervical issues, and so one of the reasons why I'll be to me miscarriages. You bet me kasa about thyroid disease. You bet me kasa about even kidney disease. Then we can also talk about diabetes. You are not properly managing. So if you have diabetes, as part of your journey towards wanting to get pregnant, you should have a proper diabetes management plan in place, because one managing year, that is one thing which can also increase your risk of having a miscarriage. Afi yemfa say onyem na again now what are you supposed to look out for, which could signal that you are probably about to lose that pregnancy. Now, when you're pregnant and you are bleeding, and the bleeding progresses from very light bleeding to very heavy bleeding. I feel blood clots. Obi a wonyi nsan no enye moja kekene too. I feel clots nyina eden ewo mu bi. Sometimes we won't say you have these cramps, this abdominal discomfort, and they are not the kind that we experience. We know say obabia no say obebunin sa some moderate or mild to moderate cramping is okay. So menstrual cramp, you know how it feels like, but then this kind of cramping is excessive. It is very intense kind of cramping. That should give you some indication, say probably you may be looking at having a miscarriage. So when you're careful, in pain peninsula you can have lower back ache and a lower back pain. All right, and they may range from anywhere between very mild to very severe lower back pain. So what I say, all of these things are signs you look out for. So naturally say the pregnancy is actually threatened in a way. Now obabi anyima onya symptoms bi. All right, afifie ne abofuno ne all of those signs are pointed to the fact to say when you say when you begin to see a decrease in these symptoms, that should also point you to the fact say ebiawa careful, you are going to have a miscarriage. Now there are incidences you have lost the pregnancy after week 20. That is a different subject, but then I'm talking about when you lose this pregnancy before you turn week 20. That is when technically a friend will say when you miscarriage. Beyond week 20, your friend is stillbirth. I'm also going to talk about that pretty much in subsequent audio sessions. Wait from a papa Menstrocare. Now, a Menstrocare Ghana, so where we handle all your reproductive health issues, into a hormonal issue, be or menstrual issue, be or a warm problem, be or infection problem, be or type 2 diabetes. Here is a place where we can help you resolve these problems. If you want to reach out to us, we are on Facebook, Menstrocare Ghana. Our telephone number is 0322-194-835. If you want to reach out to me directly too, my number is 0244-264-001. Let's keep the conversations going.
Menstrual pains, Menstrocare. Irregular menses, Menstrocare. Low sperm counts, Menstrocare.